For many expectant mothers, whether or not to get vaccinated has been a dilemma. But early concerns about possible side effects on the baby have not been borne out. And now an Edinburgh University study has shed light on the complications which can arise if women get COVID, especially during the latter stages of pregnancy. Here's Katrina Renton.
This is 5-month-old baby Matthew with big brother Joseph, who's 9, dad Chris and mum Nyree. Nyree was 44 when she found out she was pregnant in January 2021 during the pandemic.
My husband and I, we've had 7 miscarriages, so having a baby in our 40s is a miracle, and we actually didn't really think it was going to happen.
It was early on in the vaccination programme and Nyree thought hard about whether to get the vaccine.
I just took the information away and read into it a lot more, and then sadly I'd heard some stories as well, obviously some sad stories, and there was no way that we wanted to risk losing this baby, because this baby was our miracle baby, so I decided to get the vaccination.
Since the start of the vaccination programme, 4,950 cases of COVID-19 have been confirmed during pregnancy. In 77% of these cases, women were unvaccinated. The team found the death rate among babies born within 28 days of their mother developing COVID was 23 per 1,000 births, as compared to 6 per 1,000 in the overall population of pregnant women during the pandemic. It's not possible to say if COVID contributed directly to deaths or preterm births, as researchers did not have access to detailed clinical records. However, all baby deaths occurred to women who were unvaccinated at the time of infection.
Women who have COVID-19 in pregnancy and are unvaccinated at the time they have the disease have higher rates of complications. And thinking here of things like critical care admission to hospital, and very sadly for their babies being born early, or indeed sometimes dying in the womb or in the newborn period.
The numbers may sound small, but health professionals say the increase is significant.
There's really strong evidence now that COVID has much greater risks for pregnant women if they get it later in pregnancy, and that vaccination is protective. And so my message would be, please, if you have hesitated before and you're pregnant, please, please, please get the vaccination for your own protection and also for the protection of your baby.
Nyree says she's glad she was vaccinated and that baby Matthew is perfect. Katrina Renton, reporting Scotland, Roxburn.